You know the word HIPAA. It stands for Health Insurance Portability and Accountability Act. That was from 1996. It's a federal law that restricts the release of medical information without a person's consent. Katie Spector-Baghdadi, a lawyer and bioethicist, says while people often feel like HIPAA protects them from being asked about their medical information or prohibits other people from asking about their medical information, neither is true. For example, the U.S. Department of DHHS says your employer can ask you for a doctor's note or other health information if they need the info for sick leave, workers' comp, wellness programs, or health insurance. However, if your employer asks your healthcare provider directly for information about you, well, your provider cannot give your employer the information without your authorization. HIPAA's privacy rule sets regulations and limits on who can look at and who can receive a person's private medical information, and that can be whether it's electronic or written or oral. But the rule only applies to 3 groups, and those groups are health plan providers, health care providers, and health care clearinghouses. Life insurers, your employers, school districts, law enforcement agencies, they all can have access to your private medical information and are not required to follow HIPAA rules. According to Consumer Reports, HIPAA rules also do not protect your private medical data when you're wearing a smartwatch like an Apple Watch, a Fitbit, or you're using period tracking apps. Hey, 2 Wants to Know is sticking with the healthcare topic at 5:30. We've got 2 experts in to answer your questions about Medicare. Did you know that even if you're working at the age of 65, you still have to sign up for Medicare? Find out why, and you can join us and text in your question coming up at 5:30.